Good afternoon, my country people. It's yet another morning that I welcome you back to our YouTube channel, and I will start by appreciating you people for the cooperation you are giving, for the support you are giving to this channel, because I've heard so many people from the community appreciating our work. That means we are touching some lives in the community, and this was our main aim when we started this channel. I always appreciate each one of us who is doing anything, however little it is, to push this channel ahead. That's why I always encourage you people to continue subscribing, liking, and sharing our videos so that they may be recommended everywhere in this locality, and they may reach somebody and help a soul somewhere. And before I continue, if you are watching this channel for the first time, don't forget to subscribe, and after subscribing, make sure you put the notification bell on so that whenever I produce a video like this, YouTube will automatically notify you and you will never miss any of our educational bangers. If you have given your topic and we are here to discuss it, just continue being patient with me, and in due time it will be discussed. We are still on our longest chapter about kidney failure. And yesterday we started a subtopic about end stage treatment, whereby we said that in end stage treatment is whereby you find that your kidneys are working less than 15% of their full capacity. 15% is very little. You can imagine all the wastes produced in your body. They are always eliminated by your kidneys when they are working 100%. But in this case, your kidneys are working only 15%. How much waste will a kidney working only 15% will be able to eliminate? Very little. Very little. And remember, these kidneys can also help in balancing or eliminating excess fluids from the systems. That's why you find that if you have kidney failure, you are always prone to swellings, edema, which is always caused by excess fluids entering the tissues. If your kidneys are working normally, they will always sense when there is a accumulation of fluids in your body. So they always communicate to the kidneys so that it may help in releasing the excess fluids. And by so doing, there is always a fluid balance in your system. No excess fluids in your systems. So there will be no edema or swelling of any of your body parts. So let's continue with our topic, end-stage treatment. There are two treatment options for end-stage kidney disease, which are, and we talked about them. If your kidneys are working less than 15% of their full capacity, what do you expect? The treatment options are only two. Number one, we have dialysis. This is whereby your blood is filtered by a machine, then it's pumped back into your systems. And number two, we have kidney transplant. Though I've been talking with so many clients who have ever had kidney transplant, it's not always successful. Most of them usually fail. I don't know why. Most of them even plunge somebody into a worse situation than when it was before. But for 8 stage kidney disease, the treatment options are kidney transplant and the dialysis. Doctors try to postpone these options, though they are the only available options. But doctors try to postpone these options as long as possible because both carry serious risks. I've just said that I've had many people who have gone through this surgery like kidney transplant saying that they wish they knew they could not have even done that. That's why we are saying doctors try to postpone these options as long as possible because they carry serious risks. Remember, these procedures are always invasive. They involve opening of your body, and there is always chances of bacteria entering your body. So, doctors try to postpone these options as long as possible because both carry serious risks. Let's look at dialysis. This is most common. Dialysis is a system for filtering waste products and excess fluids out of your blood. Remember, we said that kidneys are the filtering systems of your body. So, here we are trying to assist the failing kidneys to eliminate the products which they could have eliminated when they were working fully or they were working at their full capacity. So, we use a machine to assist these kidneys. So, dialysis is a system for filtering waste products and excess fluids out of your blood. Two main types of dialysis include the following. We have two main types of dialysis. Number one, we have what we call hemodialysis. So, in hemodialysis, your blood is filtered outside your body in a machine. So, your blood has to come out of your body, go through the machine, then it's filtered, then it's pumped back into your system. That is hemodialysis. Blood comes out of your body. The only difference is that in hemodialysis, the blood has to come outside of your body into a machine, it's filtered, then it's pumped back into your body. So hemodialysis, your blood is filtered outside your body in a machine. And we have number two, peritoneal dialysis. Peritoneal dialysis. Here, you fill your abdominal cavity with a special solution via a catheter. A catheter is used to pump a special fluid into your abdominal cavity. The solution absorbs excess fluid and waste before it's drained to your body. I hope you get this. The difference between the two. In hemodialysis, the blood has to come out from the body into a machine, filtered, then pumped back to the system. But in peritoneal dialysis, a special fluid is pumped into your abdominal cavity through a special catheter. The solution that has been pumped into your abdominal cavity absorbs excess fluids and waste before it's drained from your body. I hope I'm clear enough and it's understandable that way. So, because dialysis usually needs to be done several times in a week, dialysis can even be done thrice in a week. So, because dialysis usually needs to be done several times in a week, it's a big lifestyle change. Because dialysis usually needs to be done several times a week, it's a big lifestyle change. Dialysis also carries risk of infection. As I have said, this thing is invasive. That means somewhere in your body has to be opened, like when you are inserting the catheter. And also the blood is coming out of your body to the machine. If a mistake happens in the machine and the machine happens to be not to have been cleaned fully, there is chances that your blood will carry infections into your systems. So let's look at the kidney transplant, which I've said many of the people who have come across and have done this procedure always regret it. I have one of my friends whereby uh, he flew to India and kidney transplant was done on him. One of his relatives uh, gave out one of his kidneys. The operation went on well, it was successful. It was a bit compatible because remember, this is a foreign body. So it was a bit compatible for some months, like 6, 7 months, then it started having problems. So now as we talk, it's worse than how it was before it was done. He is always on dialysis, and the drugs he usually takes alongside the dialysis always cost him more than 250,000 in a single month. This has led him to selling all the properties he had. He is now being hosted by the brothers. He has sold everything. That's why I always tell you people, kidneys are very important, and it's always very simple to maintain your kidneys. Just taking fluids, avoiding the urinary tract infections and all that. Hmm? Just imagine this guy. He was a billionaire. He sold his cars, his houses, plots, rental houses, and the money is going. Now the brothers now are assisting him into getting these drugs. So if it was the way it was originally before the transplant, it could have been so simple because it will need the usual dialysis. So let's make sure we maintain our kidneys always. So kidney transplant. Kidney transplant is more convenient than dialysis. Kidney transplant is more convenient than dialysis if you can find an appropriate donor kidney. It is always very hard to get an appropriate donor kidney. So kidney transplant is more convenient than dialysis if you can find an appropriate donor kidney. The donor needs to have the same blood type as you. That is very important and it's key. That the donor needs to have the same blood type as you. You can't get a donor who has a different blood from yours and expect it to be compatible or to go along with your body, because this is a foreign body and your body has to react negatively. So, kidney from a living sibling or a close relative is usually the best, or from a deceased donor. So, a kidney from a sibling or a close relative is usually the best, or from a deceased donor. And I've been asking this question how many of you there can sacrifice to give out one of their kidneys to their fellow sisters and brothers? How many? The probability is close to zero. So, kidney from a living sibling or a close relative is usually the best, or from a deceased donor. However, kidney transplant also carry a large risk of infection because you will need a lifelong immunosuppression. Kidney transplant also carry a large risk of infection because you will need a lifelong immunosuppression. So remember, this is a very foreign body in your body. It's something new to your systems. So your cells and everything will react negatively to it. That's why you always get immunosuppression. Your immune system to be suppressed so that it might not fight this foreign body or this new kidney. So let's look at long-term outlook for chronic kidney failure. Long-term outlook for chronic kidney failure. Some people with chronic kidney failure can live for many years. Some people with chronic kidney failure can live for many years. This can be accomplished through lifestyle changes and medication. You need to maintain kidney healthy regimen for the rest of your life. Let me repeat this again. Long-term outlook for chronic kidney failure. Some people with chronic kidney failure can live for many years. This can be accomplished through lifestyle changes and medications. You need to maintain kidney healthy regimen for the rest of your life. This marks the end of our video today. Thank you for those who are following me. Thank you for your time. Thank you for the subscriptions. Let's continue sharing this video and giving it thumbs up or liking so that it might be recommended everywhere in the society. Let's have a wonderful day ahead.